Okay, guys. B discussion B deals with oncology and quality of life for cancer patients. So we're going to discuss that for B. So please join me in the presentation that I set up for you. Please enjoy. Okay, here's a concise summary of the key points from policy review featured in Lancet's Oncology on Health Related Quality of Life, or HRQOL, in advanced cancer care. Main takeaways: patient-centered outcomes matter. Clinical trials should prioritize HRQOL alongside traditional endpoints like overall survival. It's not just about living longer, it's about living better. Clear definition of HRQOL. HRQOL should be measured as multi-dimensional. Patient-reported outcome, including symptom burden from disease or treatments. Functioning domains: physical, social, role, overall quality of life, standardized responder criteria. Trials should report how many patients experience meaningful improvement or decline in HRQOL. This makes results more actionable for clinicians and understandable for patients. Patient involvement and trial design. Patients should help define which HRQOL domains are measured, ensuring that trials reflect what truly matters to those living with advanced cancer. Transparent reporting. HRQOL data should be included in main trial publications, not buried in appendix. Clear, consistent reporting supports better clinical decisions. This review, led by Ian Pennock and Madeline P., with support from CSO and EORTC, pushes for more humane, responsive approach to cancer research, one that centers lived experience, not just clinical matrix. Would you like to explore how these principles could be adapted into your toolkit work or participatory framework? Prioritizing health-related quality of life, HRQOL, in advanced cancer care reshapes not only how we evaluate treatments, but also how we design systems of care, communicate with patients, and allocate resources. Here's a breakdown of key implications. Clinical implications. Treatment decisions become more nonsense. Clinicians can better tailor therapies based on what improves or preserves patient daily functioning and well-being, not just survival matrix. Reduced over treatment. When HRQOL is centered or central, there's a greater syncuity of interventions that extend life but severely compromise comfort and autonomy. Improved symptom management. Trials that measure HRQOL highlight symptom burden, leading to more proactive pain, fatigue, and distress interventions. Research implications. More patient-centered trial designs, including HRQOL as a co-primary endpoint, encourages trials to reflect real-world priorities, especially for those with limited life expectancy. Standardized matrix for impact. Using responder criteria, e.g., percentage of patients with meaningful HRQOL improvements, makes data more actionable and comparable across studies. Elevated role of patient voice. Patients help define which domains matter most, whether it's cognitive clarity, social connection, or independence. Policy and system level implications. Shift toward value-based care. HRQOL matrix supports reimbursement models that reward outcomes aligned with patient goals, not just clinical thought. Equity in care delivery. Culturally responsive HRQOL measures reveal disparities in system burden and access to supportive care, guiding targeted interventions. Transparent reporting, accountability. Publishing HRQOL data in main trials results, not appendices, builds trust and informs shared decision making. Ethical, humanistic implications. Reframes what success looks like. Success isn't just about tumor shrinkage, it's maintaining dignity, autonomy, and connection. Supports informed consent. Patients can weigh trade-offs between longevity and quality with clear clearer data on how treatments affect daily life. Center's lived experience. It honors the reality that for many, for many, how they live matters more than how long they live. Would you like to explore how HRQOL matrix could be adapted for culturally tailored interventions or integrated into your evaluation matrix? I think there's a rich potential for co-design here. Implementing health-related quality of life, HRQOL, in clinical practice and research, especially in advanced cancer care, comes with a host of challenges that span methodological, cultural, systemic, and ethical domains. Here's a structured breakdown tailored to your system's level lens. Methodological challenges. Lack of standardization. HRQOL instruments vary widely in domains, scales, and implementation. Without harmonized tools, comparing outcomes across trials or populations is difficult. Responder criteria complexity. Defining what constitutes a meaningful change in HRQOL is nonsense or non thresholds may differ by context, culture, or disease stage, complicating analysis and reporting, timely frequency and measurement. Capturing HRQOL appropriate intervals is tricky. Too infrequent and you miss fluctuations. Too frequent and you risk burdening patients. Culturally and equity changes. Culturally, validity and instruments. Many HRQOL tools were developed in Western contexts, and many not reflect values, language, or priorities of marginalized or non-Western populations. Digital and literacy barriers. Patients' reported outcomes often rely on digital platforms or written surveys, which can exclude those with limited access to or limited access or literacy. Underrepresentation trial design. Minoritized groups are often left out of defining HRQOL domains, leading to matrix that misses culturally specific burdens or strengths. Cultural practice or clinical practices challenges. Integration to workflow. Clinicians may lack time, training, or infrastructure to collect and interpret HRQOL data during routine care. Actionably gap. Even when HRQOL data is collected, it's not always clear how to translate it into treatment changes or supportive interventions. Competing priorities. In high pressure settings, survival matrix and disease control often overshadow quality of life considerations. Reporting and policy changes. Inconsistent publications practices. HRQOL findings are often related to appendix or secondary publications, limiting their visibility and impact. Lack of incentives. Regulatory bodies and prayers may not reward HRQOL improvements, reducing. Give me a second, guys. Motivation to prioritize them in trial design or care delivery. Data interpretation complexity. HRQOL outcomes are inherently subjective and multi-dimensional, making them harder to interpret than binary clinical endpoints. Ethical and philosophical tensions. Whose quality counts? There's tension between clinicians' defined acceptable quality of life and what patients actually value, especially in end of life contexts. Okay, guys, so that is B for you. I'll be back on shortly with C. Give me a little bit for a break, please, and I will be back on with C shortly. So for now, Gator Wellness, take care, folks.